DNA synthesis inhibitors are a group of antibiotics that target the synthesis of DNA in bacteria and other organisms. Metronidazole, a 5-nitroimidazole, prevents the synthesis of nucleic acids, which are the building blocks of DNA, and is effective against many bacteria and protozoans. Metronidazole and related 5-nitroimidazoles are relatively non-toxic to humans. This is because in order to function, they need to be reduced by a protein called ferredoxin, which contains sulfur and iron. This protein is commonly found in anaerobic bacteria and protozoans, but is not as available in humans and aerobic bacteria. Now, this protein can donate an electron to metronidazole, causing it to form free radicals which will damage the DNA, causing it to fragment. Without the DNA as a template, the organism can't synthesize any more nucleic acids like DNA or mRNA, which will lead to cell death. Metronidazole can be taken orally, but it's also available in an IV form and as topical creams. It penetrates well into body tissues and fluids, including vaginal secretions, seminal fluid, saliva, breast milk, and cerebrospinal fluid, and crosses over the placenta.
Enjoying our Osmosis videos? Unlock your full potential with an Osmosis subscription. Get unlimited access to every Osmosis feature and resource with a free 7-day trial.
This medication can treat many anaerobic bacterial infections like Clostridioides difficile, which can cause pseudomembranous enterocolitis in people taking other antibiotics. Another common organism treated by this medication is Helicobacter pylori, a common bacteria that causes gastritis and peptic ulcers. However, it should be used in combination with other antimicrobials and proton pump inhibitors as part of a triple therapy for the best outcome when treating this condition. Next, Gardnerella vaginalis and other anaerobes that can cause bacterial vaginosis are all treated by metronidazole. For protozoan infections, it's the medication of choice for amoebiasis, an infection of the gut caused by Entamoeba histolytica. It's the medication of choice against Trichomonas vaginalis as well, which causes vaginal trichomoniasis. Finally, metronidazole is highly effective against giardiasis, or beaver fever, which is an infection of the gut caused by Giardia lamblia. Metronidazole is metabolized in the liver, and it's an inhibitor of CYP450 enzymes, so it can slow down the metabolism of other medications, like warfarin, which are also broken down by this enzyme. Common side effects of metronidazole include decreased appetite, nausea, a metallic taste in the mouth, headaches, and stomach cramps. In high doses, or in chronic treatment, neurological effects such as seizures, confusion, and peripheral neuropathy can be seen. It is usually not recommended during the first trimester of pregnancy as a precaution. Finally, although it is not well understood why, metronidazole may cause a disulfiram-like reaction in some people, where if the person drinks alcohol while taking metronidazole, they experience severe nausea, vomiting, and headaches. Now, we want to make a simple and fun mnemonic that'll help you efficiently memorize and retain all these pharmacology facts. So first, let's put a giant metronome in a garden scene for metronidazole. A chrome-colored cell is crushed under the metronome to help you remember this drug inhibits cytochrome P450. Now, there's a giant fishbowl here to help you remember metronidazole is effective against anaerobic bacteria. For the decorations in the fishbowl, there's a closet for Clostridioides, a little helicopter for Helicobacter, and a plastic gardener for Gardnerella. For the protozoans, let's use a giant gerbil to represent Giardia. He and his buddies, a giant amoeba representing Entamoeba, and a triceratops representing Trichomonas, are hanging out and eating all the flowers in the garden. For the important side effects, let's put a couple of empty beer bottles by the gerbil to represent the disulfiram-like reaction. His arms are covered in bandages to represent neurotoxicity, like peripheral neuropathy. Alright, as a quick recap, metronidazole is an antibiotic that targets anaerobes like Clostridioides and protozoans like Giardia. This is because these organisms have a lot of the protein called ferredoxin that allows metronidazole to generate free radicals. These free radicals will damage the DNA so additional nucleic acids cannot be synthesized. But wait, there's more! Here's a mind map with all of the mnemonics from the video. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers at the end.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more